You're watching ADBN TV, where we spotlight the issues shaping the Niger Delta region and, of course, the nation. Now, in Akwa Ibom, Governor Umo Eno has declared a state of emergency in the health sector. A lot of people believe this is a bold move meant to overhaul failing facilities, recruit more workers, and restore public confidence in healthcare delivery. But behind the declaration lie urgent questions. Some people are saying, why now? How deep are the problems, and will the remedies truly meet the needs of citizens across the 31 local government areas of the state? Now, today, we are being joined by the member representing Essien State constituency in the Akwa Ibom State House of Assembly, himself also the chairman, House Committee on Health. To help us unpack the realities on the ground, we have Honorable Moses Essien joining us live on the program. Thank you very much for coming on the program, sir. It's good to have you again.
Thank you very much. It's a pleasure to be here.
Indeed. So when the news about the state of emergency being declared on the health sector in Akwa Ibom State came on board, a lot of people were trying to understand the specific triggers that led to this. We know that this came immediately after that maternal mortality story broke, and it was really a sad incident. We saw committees from the Akwa Ibom State House of Assembly moving around trying to ascertain what were the root causes of this particular incident. But then, not long from then, we had a state of emergency declared on the health sector. Could you bring us up to speed with some of those triggers that led to that point?
Well, thank you very much once again for having me in this studio. And good afternoon, viewers. And it is true that the governor of Akwa Ibom State has declared a state of emergency on the health sector of the state. This is because of the culmination of the activities of the oversight conducted by the House Committee on Health. You see, the issue lies in the fact that the House of Assembly is the only enabling institution that make appropriation for the funding of the health sector. And so it is also our constitutional right to ensure that those appropriations we made to the health sector are properly utilized. And so before the complaint of the mortality rate on the issue of the woman that went to put to delivery and at the end lost the child and the mother also passed on, the House of Assembly as a people assembly cannot fold their hands to watch citizens of Akwa Ibom State who, having known the passionate mind of His Excellency the Governor and the health sector, I would like to find out what really was the root cause of the issue, and then find out what remedy could be given to those who were involved. And so at the end of the day, we went for the oversight, and we were able to interview the doctors that were on duty on that date. And then conversations were also made. And because we cannot strictly rise into a complete conclusion on the fact that the governor on his own have also decided to set up a committee to do proper investigation that is made up of eminent professionals in the health sector. And so that committee has also swung into action immediately after the House of Assembly also undertake oversight of the facility. And so we believe the investigative panel set up by the governor have turned up their report and was given to the commissioner, whom we are also aware, have handed over the report to His Excellency the Governor. And we believe that measures will be taken to ensure that those involved, if wrongly involved in that matter, are also brought to book. The oversight conducted by the Committee on Health in the Akwa Ibom State Assembly have yielded positive results. The positive result today is that the governor have declared this state of emergency on the health sector. And what are the contents of the emergency? The governor have decided that all the health facilities in the state should be upgraded. Those facilities that we believe are not available, like most of the hospitals we visited, you go to the lab, you will not see laboratory equipment that will aid proper health services. And so the governor have directed the interministerial committee to work under this emergency declaration to ensure that all those hospitals are upgraded and brought to the modern status where it would depict a general hospital status.
All right. Well, some people would want to also know, because a lot of reactions trooped in regarding this particular incident in Ikotekpene. And some people are already pointing accusing fingers regarding how well equipped, when we talk about manpower at the hospitals across the state. Is this as a result of poor availability of manpower in the hospitals across the state, or was there an issue of negligence? Yes, you said the reports are already out, but
yes,
these reports are not made public. How do the questions around the issues surrounding what really happened on that day, how do we resolve it, and how can the people of Akwa Ibom State be assured that events of that nature will not have to be what they would need to worry about, in the healthcare system?
Well, on the part of the House of Assembly, as we went for the oversight, we spotted negligence. And so while we understand that there is insufficient manpower as the oversight result showed, we believe that what happened at Ikotekpene was purely an act of negligence to our own part as lawmakers. But the committee that have been set up by His Excellency Governor would do deeper work, since I met up professionals in the health sector, to be able to spot actually who is at fault and also ensure that appropriate sanction or punishment is meted out. And so we want to believe that people should not panic. People should decide to be patient and see the outcome of this result. Things have been turned into the governor. Very soon, I'm sure members of the public would be made to know the outcome and what is the result of the investigative panel.
All right. Well, the emergency involves recruiting about 2,000 healthcare workers and also upgrading facilities, as you rightly put it. But can you share insights regarding how these upgrades are going to be spread across the local government areas? I mean, we know that some work has already started when we talk about upgrades of health facilities across the state. But is this going to be more intentional, talking about the work that is going to ensue within this emergency period?
Yes, let me also say it here boldly. For those that have been following up the activities of the state government, you would agree with me that the proposed supplementary budget that's going to be forwarded to the House of Assembly that have been approved by the Executive Council has a lot of finances allocated to the health sector. This is in a bid to assure members of the public that emergency declaration is not a child's play. So His Excellency, in his kindness, have made India last ESCO meeting where they approved for a supplementary budget. I make a lot of provisions for financial provisions, and when they brought it to the House of Assembly, we also look at it critically, and where it needs us to add, we'll add. It needs us to subtract, we'll subtract. It needs to maintain the status, we'll do same. The emergency declaration is going to give more space in terms of construction of more building to contain the workforce available in the health sector in that facility, and also ensure that facilities that were not available in terms of a blood bank, in terms of a scanning machine, in terms of a machine for chemistry, in terms of machine for proper diagnosis in the lab, these machines are going to be made available.
All right, Honorable, you spoke about release of funds. Now, that's one thing. When the funds are released, another thing comes to play, which is efficient use of these funds, ensuring that they are not diverted or delayed. What are those measures that have been put in place towards ensuring that these loopholes are plugged and we don't have situations or incidences where funds that are allocated for a specific purpose within the health sector are either delayed or prevented from going to those purposes?
Yes, let me assure the members of the public and the people, even Nigeria at large, that the responsibility of the House of Assembly is to carry out oversight. And when you carry out oversight is to ensure that money meant for a particular purposes in government facility are not diverted. We would assure the public that the House of Assembly would never renege in our responsibility, Section 127 and Section 128 of the Constitution of Nigeria have empowered the House of Assembly to carry out this oversight on an institution they have power to make law. It is because we are the one that's going to approve the budget for this health facility. And so when we approve the budget for the health facility, it is our responsibility to ensure that those monies we appropriated, it is not diverted to any other issues. And so when we go out for oversight, they ask questions about the budgetary provision we made in the budget for the facility and ensure that those in charge are accountable to the money that we made and ensure that those things that the money were meant for are done for the sake of giving adequate medical services to Akwa people.
Okay, well, during your tours of some of these health facilities, for instance, in Essien and even in Ikona, residents raised concerns regarding, lack of drugs and the issue of facilities being inadequate and all of that. Were you truly able to connect with how the people felt and the necessities that they are beckoning for within the health sector? And from what you were able to witness firsthand, is the situation really dire? And how committed is the state government towards ensuring that it resolves these issues? Because, when we talk about health, first things, when we talk about security in the state, the next thing that comes to mind is, are the people healthy?
Yes.
What is that level of commitment as we speak?
Well, let me also say it with boldness that the members of the public are going to be very happy over our oversight visit. Because like I said earlier, at Ikono, it is very wrong for you to have a general hospital with only 2 medical doctors, the medical superintendent and 1 other doctor working in that facility. How can they contend giving adequate medical services to the members of the public that access that facility? And so at the end of the day, it is not we that brought this thing to the front burner of government. The governor would not on his own say, let's reopen the employment portal and employ more medical professionals to work in the health sector. And so I want to say it that members of the public should not in any way be worried. We are People's Assembly, and we will also continue to work with the people. And so what we are doing together is to bring succor to the people of Akwa Ibom State that the health sector is going to have a serious upgrade that will make sure health services is available for our people.
Well, every year we see situations where medical doctors that have been trained in our universities graduate, and it's as if the process of them being absorbed by the system is slow. Is the state government doing anything currently towards ensuring that these fresh graduates are trained and equipped to get into the workforce and also help with the burden of staffing in the different hospitals of the state?
Well, the first thing is the employment. And when you get employed, there are certain time you have to work before you can even go for in-service training. And so those periods, you have to exhaust them because there is a service rule that governs every employee under government payroll. And so in-service training is part of those training that equip these medical doctors who have been employed to work under the state government employment agency. We have had series of issues where a medical doctor have been declared wanted. You cannot work under the employ of the state and then the state send you to in-service training. When you go for in-service training, you are no more working in that facility. You are now under the training sponsored by the state government because you see collect salary. So when you see collect salary from the state government, indirectly, that is part of the issue that this government is giving to assist you, to ensure that you don't complain in terms of having what to eat. Your salary is being paid. And so at the end of the day, when you finish, you're supposed to pay back the government for the services of training they offered you. And so some doctors, because they believe, maybe in other states, they believe that their friends or colleagues are being paid higher. And so most of them deviated from the service rule that governs them under the Ministry of Health and so Hospital Management Board. And so on the strength of this, I don't want to go into summary conclusion on the issue. But I want to believe that we as a House of Assembly will also step in to to also call that doctor that been declared wanted, if need be, and then have interviews with him to find out the veracity of even his own presentation that I've made on social media, trying to dent even the measure of the state government and the Commissioner for Health. We'll look into this matter and bring amicable solution to it. The Commissioner for Health, in my last communication with him, also made me understand the governor has given approval for a salary upgrade of medical workers in Akwa Ibom State.
Well, that was what I was going to drive at, because, I mean, is it possible that these issues of welfare are resolved once and for all? Because, I mean, when you talk to a medical practitioner, the next thing that comes to mind is welfare. And the next thing they want to talk about is leaving the shores of the country. Is there a way that Akwa Ibom can create a template where other states want to borrow from, or even doctors from other states would want to come to Akwa Ibom to work?
Some times ago in this state, during the government of Godswill Akpabio, some medical doctors, almost all medical doctors were provided with the utility vehicle to assist them in the discharge of their duties. This was done. So, but if you look at the workforce we have in the health sector, most of the states don't have this kind of number of health workers working under the employ of state government. And so more than 400 medical practitioners are working under the employ of the state government. And so for you to buy vehicle for 400 personnel at a time is not possible. But the government would devise means to look at how to start even the senior cadre of doctors that work in the state government. And so I want to show you that with what is currently going on in the ministry to the Commissioner for Health, most of our doctors working outside, some of them might be forced to come back to Akwa Ibom to work, because there's going to be good remuneration, increased salary, increased welfare, good incentive given to our medical practitioners.
Well, the government had announced intentions to shut down facilities where you have unqualified workers and facilities where there is no equipment to cater for, health issues. What is the time frame for the implementation of this, especially as the state of emergency on the health sector subsists?
Well, the emergency declaration is going to cover all the secondary facilities in the state. But as a government, it's not possible for you to, in 1 month, to finish upgrading all the 42 secondary health facilities in the state at a stretch. It's going to be in segment. Maybe in the first 3 months, by my discussion with the commissioner, not less than 6 secondary facilities in the state will be upgraded. When they mean by upgrade, medical superintendent come to a roundtable discussion. What and what do you think you don't have in this facility that can make adequate medical services for our people? And then you mention those issues we are also raised on our own during our oversight, but we also take into consideration. So the emergency declaration might take approximately 1 year to ensure that all those health facilities in the state are upgraded. Take cognizance of the fact that in the budget of 2025, we also made provision for a general hospital for Ibionibon, where I come from. It is under this emergency declaration, all those hospitals that were built, Uyo don't have one, Ibionibon don't have one, we must be able to look for a way and ensure that this low government, with the level of the population we have a general hospital. So I want to assure you that the government of Pastor Umo Eno is going to do a lot with this emergency period to show people of Akwa Ibom State that the government is passionate to improve the health sector of the state.
Well, we went down the conversation by taking you a trip back to Ibom, where you represent.
Yes.
You've also taken your oversight there, I believe, and since it is your primary location, constituency, what have you observed in Ibom? Would you say that the health facilities there are up to par, or there's still a lot of work that needs to be done? And within this emergency period, what work are you going to personally be doing towards ensuring that attention is also drawn to the Ibom people?
My duty is to carry out my constitutional responsibility as given to me by law. We will continue in our oversight. One, like I said earlier, we are the one that approve the money to the health sector. The salary of doctors, we are the one that approve for the salary to be paid. And so there is no way I will be in a table where food is shared and my local government is ignored. I'm supposed to be the one to take the highest share because the chairman has committee on health. And so more than 41 primary health care facilities are available in Ibionibom. Let me also shock you. This emergency declaration on the health sector do not only affect the secondary facility alone, it would affect primary health care because that's the bedrock of the health services of our people. And so the governor also taken the issue of insufficient manpower, not only in the secondary facility, but also in the primary health care, primary health centers. And so this employment that's going to be done will also affect those to be employed to work also in those primary health care centers in each of the local government. So if we have more than 400 primary health care centers in the 31 local government area of the state, those more than 400 health facilities are going to be catered for by this emergency declaration, because each of these health centers have to benefit from the provisions made by the governor in this declaration. I can assure you that one.
Well, Honorable Moses Essien, last time we spoke on the issue of Ibionibom, you had made some very interesting remarks as regards your future permutations and efforts towards ensuring that that local government is truly a template for others to follow. Are there any new activities that you've been backed on since our last conversation?
Well, recently I've just been able to inaugurate most recent Unity Football Competition Committee. And I want to believe that with the recent Akwa Sport Festival have just been concluded, local governments need to also tap into this sport development also so I can be able to showcase most of our sport talent. And so I'm going to embark on a football competition, and we're going to commence on the 5th of October. And then various personalities will be invited, and they want to show I can showcase our local talent. Most of our people have the talent for sport, football. I want to see I can have a Ibionibom person be like Kanu Wanko. I want to see I can make a Ibionibom person be like there are so many,
there are many names.
Many names we have in the sport industry. And so my duty is to also contribute to my constituency by tapping into most of these talents and showcase them for those who are interested to also take them up beyond the shores of Nigeria. So these are one of the issues briefly I'm going to do. Secondly, by November, I'm going to also touch the primary schools in Ibionibom to also support His Excellency Pastor Umo Eno's rice agenda on education. I have intention to ensure that I provide educational materials to cover all the primary schools within Ibionibom State Constituency. We have about 64 primary schools available in Ibiona. I've made the statistics. I also look at the statistics of the number of pupils available in each of the primary schools. I'm going to make educational material available to assist these pupils in this primary school as part of my contribution to education. Apart from the bursary grants are given to those in technical institutions, let me also do something to encourage those at the primary level in terms of tapping into the world of the education sector of the state.
Honorable Moses Essien, member representative of Ibionibom State constituency, thank you very much for speaking to us on Niger Delta today.